Okay. Have you eaten today? No, because you have to get your blood. Okay, good, good. I mean, I think you've already gotten it, right? In the morning?
Oh, yeah, that's
I already got the results here. So, Miss Neha, how have you been recently? Any symptoms? How are you?
fine.
You're fine? It's okay? Have you had any like excessive thirst recently or going to the toilet more frequently?
Yeah. Past few weeks actually, I minum a lot. Every night I just need to go to the bathroom. It's been really bad.
How about like hunger? Do you get hungry more often?
I feel like normal.
You feel normal.
But I think like quite a month already.
Oh.
She been experiencing the symptoms. Like she needs to wake up at night, go to toilet, and then she feels like very thirsty. Why, doctor? Because for the past 2 years, like she was diagnosed with diabetes, but then she has no symptom at all at the time. So why, doctor? Now she had all the symptoms.
Actually, I need to check back with her lab results as well. You know, as you can see, based on the lab results, her HbA1c is quite high. Her fasting glucose is also quite high. It's actually at 13 for her HbA1c, and her fasting glucose is at 8. So I would like to ask, so are you all doing any monitoring at home?
Yeah,
we do.
Roughly around what are the readings if you all do?
Sometimes it can be 8, and sometimes it can maybe like more than that.
Sometimes got 6 also, doctor.
Okay, so it fluctuates lah. Yeah, I'd just like to advise maybe next time you all can record it down and you all can bring for the next follow-up so doctors can also monitor. Alright? Okay, so Miss Neha, usually what do you have for breakfast, lunch, dinner?
Sometimes I have coffee some days, and then I eat biscuit a bit also.
Okay. For your coffee, right? You take it every day?
No, sometimes I don't.
Hey, you need your coffee every day, right?
Okay, it's okay, Miss Neha. How many spoons of sugar do you use usually?
3.
3. Okay, it's okay. You need to actually try to control your sugar for your diabetes. Okay, for your coffee as well, do you often use 3-in-1 or do you like prefer taking like coffee oat or something like that?
3-in-1 sometimes easy lah, doctor.
Okay.
Yeah, you should change one too.
It's okay, you can use everything, but just in moderation. I just have to control your amount of sugar in your meals and also your drinks. Okay. How about your lunch and dinner? Do you often eat out?
Sometimes, but I cook also sometimes also.
We just had our McDonald's yesterday.
Yesterday? Okay, it's okay. Like I said earlier, in moderation it's fine lah. But Mr. Hadi, please keep an eye on your wife. We don't want her condition to be worsening actually. Okay. Lastly, since you've been prescribed with insulin right previously, how has it been going? How many times do you take your insulin?
3 times a day.
3 times a day. So it's okay lah. You're compliant to your oral medications as well?
Yes, I
Okay, however, I don't know why, since you're claiming that you're compliant, right? We need to check on your insulin technique. So I would like to refer you to our diabetic educator, okay, and also our dietitian lah. Hopefully it'll be beneficial for you all just to get a better idea and all that. Okay, for your medication, I'll continue with your medication. So we'll see how it improves with a proper insulin taking technique and also better diet lah, a better diet management plan for you. Okay, so I will refer you to both our dietitian and diabetic educator. They'll come meet you outside. So this is what you need to give to the pharmacy for your medication. After you give it to the pharmacy in front, just wait in front.
Okay, doctor.
Okay, thank you. Thank you so much. I'll see
Thank you, doctor.
I'll see you in 4 months.
Miss Neha, saya diabetic educator. Boleh ikut saya kat bilik. Okay, Puan Neha, jadi saya diabetic educator nurse. Jadi ni saya nak doktor refer dekat saya sebab dia tengok barisan sugar tu tak baik dah. So hari ni saya nak assess masa ni Puan punya insulin technique injection. Okay, sebelum tu, boleh saya tahu Puan gunakan jenis apa?
Insulatard.
So 3 kali sehari.
Ya,
Okay.
okay.
Semua nangis tak injection?
Tak, saya selalu ikut.
Selalu ikut?
Sometimes dia tidur je, dia tak injek pun insulin.
Malam-malam sampai
Kena
akan
miss
saya
lah.
lepas work kerja.
Okay. Yang ini saya nak, kalau boleh jangan miss lah satu suntikan insulin tu. Okay, hari ni saya nak tengok macam mana Puan Neha gunakan injection insulin.
Ni.
Buat depan saya. Okay. Salah tu sebenarnya memang kena goncangkan insulatard, tapi goncang tu macam ni je. Like this ya. Jangan kuat sangat. Okay. Then Satu je. Okay. Sebenarnya saya nak tunjukkan cara yang betul lah untuk injection. Okay. Pastikan sebelum inject tu injection pen tu is 90 degree lah. So where is the injection site? Dia sebenarnya boleh dua side daripada pusat mana-mana tempat.
Okay.
So sini boleh, sini boleh, sini boleh. So sebelum cucuk tu pastikan ni 90 darjah. And then picit sikit. And then bila cucuk tu, cucuk insulin, lepaskan yang picit ni. And then wait for 10 second.
Okay.
Then wait for 10 second and then lepas. Good.
Boleh cucuk dekat perut je ke?
Sebenarnya dekat perut tadi yang saya cakap tu dua siang daripada pusat mana-mana tempat. Dan then kat tangan boleh, kiri kanan. Dan kalau nak inject kat perut boleh juga. Jadi kat area sini, ni sini, sini ya.
Sini.
Ini mesti 5 finger berada sini, 5 finger sini, sini je yang boleh. Okey. Okey.
Okay.
Ada lagi apa persoalan?
Tak ada.
Okay, kalau boleh saya nak cari pantau lah. Saya nak kuasa cara injection dia tiap hari. Okay. Okay, ada apa-apa lagi soalan tak?
Doktor tadi suruh kita pergi dietitian.
Oh, dietitian.
Dietitian dekat mana?
Oh, dietitian bilik hijau. So, lepas ni saya boleh pergi kat bilik hijau lah.
Okay.
Okay.
Good morning, Mrs. Neha and Mr. Hadi.
Morning.
So I see you all coming here because the doctor has referred you all here today. Before that, can I know if your diet has been on proper control since you're on diabetes for the past 2 days, 2 years,
No, she never control the diet.
or at all?
Yeah.
Okay, so usually what do you take for breakfast, lunch, and dinner?
Breakfast sometimes I have coffee and then a biscuit ke apa ke.
Does she control her sugar level when she makes coffee and all?
No, it's just food.
Okay. So, have you heard about the suku-suku separuh technique? Okay, so I would advise you to follow this technique where you should take the rice which is in suku amount, that suku, and then another suku, take ayam. Although you like chicken, but please make sure it is controlled in just that suku size.
Okay.
And another separuh, make sure you take vegetables and fruits. So even if you don't like it, make sure you take that in separuh amount. It should be
Yes.
half of your food.
She hates vegetables.
Okay, so make sure you make sure your wife takes fruits and vegetable after this lah. And then because if she doesn't control her diet, then it will be very hard to reduce her glucose level. Although she is compliant to her medications lah. And so what about her physical activity? Does she exercise regularly?
She rarely exercise.
Okay, is she going to work?
Yeah.
Okay. So if you are not going for work, do you exercise?
Sometimes with the children just walk around.
Yeah, we walk lah. Walk.
Okay, so we would advise you to exercise at least 150 minutes per week, which is like around 30 minutes per day. Just have a good walk with your children or with your husband. You can walk with her also. And for now, we start with walking. Then later, if she's compliant, then we look at the glucose level. Then we will think about if she needs any intense activities. Okay. So is there anything else to ask?
No. Betul.
Thank you.